Namaste. Today topic is nosocomial infection and also we can call it as hospital acquired infections or we can call it as healthcare associated infections. This is a part 2 of nosocomial infections. Today we are going to discuss about CLABSI. So before going to that, what is nosocomial infection? Nosocomial infections, also referred to as healthcare associated infections, are acquired during the process of receiving healthcare that was not present during the time of admission. So the infection was not present during the time of admission. It was occurred after 48 hours of admission. So that we used to call it as nosocomial infection. What are all the four main nosocomial infection in the sense? CAUTI, catheter associated urinary tract infection. SSI, surgical site infection. After surgery, if patient develop any infection, we'll call it as SSI, surgical site infection. CLABSI, central line associated bloodstream infection. And VAP, ventilator associated pneumonia. So these are all the main most common nosocomial infections we used to see in a hospital. So what are all the common organism we'll see when patient had a nosocomial in the sense E. coli, enterococci and candida. So how are we going to prevent the nosocomial in the sense we have to do maximum hand washing. So hand washing definitely it will reduce the cross infection as well as nosocomial infections, and proper usage of personal protective equipments, and try to remove the catheter as early as possible if it is not required, and usage of antibiotic and antimicrobial usage, and routine disinfection. If you follow these many strategies, definitely we can reduce the incidence of nosocomial infections in the hospital. So maximum we have to do the hand washing and usage of personal protective equipments. If it is not required, early removal of invasive line and proper usage of antibiotic and disinfection process. So what is CLABSI? Central line associated bloodstream infection. So today we are going to discuss about CLABSI. So CLABSI in the sense central line associated bloodstream infection. After insertion of central line, after 48 hours of insertion of catheter, if a patient developed any symptoms of infection, bloodstream infection, we'll call it as CLABSI. So what causes of a CLABSI? CLABSI are often caused by skin bacteria from a patient or caregiver. So on the patient's skin, if you are not properly disinfecting, or from the healthcare worker if they made any contamination during a catheter insertion, there are chances of getting CLABSI. The most common organism causing a CLABSI is coagulous negative staphylococcus, E. coli and enterococcus. We can see in a bloodstream infections. So after insertion of a catheter, what causes CLABSI? So there are chances of skin organism. So while insertion time, if we are not following proper protocol, there is a chances of getting of infection by the patient. So it may be the skin disinfection. If we are not done proper skin disinfection while insertion of a catheter, again there is a chance of getting infections. Or if the healthcare workers hands are contaminated, or if we use any contaminated disinfectant solution while insertion for a skin preparation, again there are chances of getting bloodstream infections. So once after the insertion, again the strategy will be continued till the removal. So we have to maintain a catheter in a proper manner. Always whenever we are manipulating a catheter, we have to use maximum sterility. Okay, and also whenever we are using of a hubs catheter ends, it has to be disinfected before usage. So and also once it is used, immediately it has to be sealed, and whatever the IV sets are infusion sets we are using are connecting to the central line, it has to be maintained maximum sterility, and don't use any contaminated catheters or IV set to the central line. If we use any contaminated catheter, again it will cause bloodstream infections. What are all the signs and symptoms of infections for CLABSI? So, we can come to know patients developed catheter related bloodstream infections. So, there are symptoms like patient will develop with fever, chills, or increasing of a heart rate, redness, swelling, or tenderness over the catheter site, or drainage from catheter, and also we can see increasing of total count. So these many signs and symptoms of CLABSI. So how to prevent CLABSI? Okay, so there are 5 principal or strategy to prevent this CLABSI, or see we can say CLABSI or CRBSI, catheter related bloodstream infection also, or central line associated bloodstream infections. So how to prevent this CLABSI or CRBSI? In the sense, maximum hand washing has to be done whenever we are handling of a catheter, and full barrier precautions during insertion of a central venous catheter, and also chlorhexidine based skin preparation. So always proper skin disinfection will help to reduce bloodstream infections. So proper disinfection has to be done, and avoid insertion of a catheter in femoral site. So it is a least option. Preferably we should put in a jugular. So avoid insertion of a catheter in femoral site. Again it will help to reduce a bloodstream infection, and also removal of catheter when no longer indicated. So plan for the catheter removal. So if a patient not require catheter for a longer time, so immediately start removal of a catheter, so that it will help to again reducing of a catheter related bloodstream infections. If you follow these many instructions or care bundle, definitely we can reduce the incident of CLABSI or CRBSI incidents. So this is the thing we need to follow to prevent CLABSI.